Right next to me is Dr. Lam, who is a pulmonary specialist. So we're talking about the respiratory system today. And it has something to do with me. Today we're talking about sleep apnea, and on the show I've done similar tests, and I do have a bit of sleep apnea. You're right, you do have it. Huh, how can you tell? All you need to do is look at me? Yes, all I need to do is look. How come? Good question.
05年咧，嗰陣時香港大學同溫哥華大學一齊做咗個研究，就係睇下嗰個人嘅。
Back in 2005, University of Hong Kong and a university in Vancouver has done a study together.
估計有冇？但睇個樣就係睇側面嗰個樣，因為你。
And they did a study on whether if a person has sleep apnea by looking at their face profile.
坐喺度啱啱睇到你嘅側面，睇咩咧？佢就係睇個下巴。
Have someone sit there and look at their side profile.
同個頸嗰個角度，所以你閣下個角度咧。
They are looking at the angle of the chin to the neck.
接近180度。
And your angle is about 180 degrees. And the greater the angle, the more likely you will have sleep apnea.
估到嘅，所以雖然你話
So I can guess you do have it, even though you have a very standard body type and you're not overweight at all.
點解有上面就先？
And why do you have sleep apnea?
其中一個原因啫。
Overweight is only one of the reasons.
所以面型結構，中國人我哋大部分都唔。
It's about your facial structure. Compared to Westerners, most Chinese are not overweight.
嘅，同相比外國人嚟講。你話邊度啊？即係嗱呢個
What are you
呢個
talking
下
about?
巴呢個嘅平時咧，咁樣下巴同頸有個角度咁
The
樣
angle
正常係咁樣
from the chin to the neck.
個下角度係咁樣。
Usually it's like this, but yours is like this, close to 180 degrees.
冇錯啦，
And you're looking at the
所以我哋
profile.
但係頭唔使抬高或者不低
So
正視
you don't have to look up, you look
望
forward.
住前
You
方，
just
所
gotta
以
look
你睇呢度
forward
咧一
and
條
you
直
look at
線
this
啊，
and you look at
正
the
常應
angle
該係咁樣，
between your
所以
chin
咁樣
and your neck.
係啊。
Usually
所以呢
it's
個角度，
like this, but
呢個我
yours
哋
is
俾
like
咗個
this.
名嘅，我哋嗰陣時
We
叫
have a name called
Mallampati angle，
Mallampati angle,
我哋諗出
MPA.
嚟嘅嗰陣時。
That's what we came up with.
Mallampati 咧係一個嗰個麻醉科醫生嘅名。
Is a name of an
佢好多年前，因為
anesthesiologist.
史肖瑞嗰個病人伸條
And
脷出嚟
many
呢
years
個網
ago,
你就估
all
到
he
插
needed to
口。
do was to have the patient show them how far you can extend your tongue.
有幾困難，麻醉科好多時幫病人要插口。
And then they can predict how difficult it is to intubate that patient, because many patients in anesthesiology will need to be intubated.
插口困難嗰啲人都係下巴縮得後啊。
And most of the patient who is difficult to intubate has a recessed chin.
大部分中國人下巴都係縮得
And
後
most
啲，所以
Chinese
雖然
have
我哋
recessed
肥
chin
大，
even though we're not
香
overweight.
港嘅睡眠窒息嘅
But the prevalence of sleep apnea for those in Hong Kong is the same as those in Western countries.
發生率同外國人係冇乜分別嘅。
好，咁啊，今日對唔住啦，我而家
Oh,
嚟睇醫
sorry,
生。
I'm actually here to see the doctor now. I have sleep
係咪
apnea.
好普遍？
Is it very
即係
common?
相當
Oh, it's very common.
係咪啊？我都有好
相當
多。
譬如我哋講香
In
港
Hong
我哋講
Kong,
香港30至
From
60
30 to
歲，
60 year
男
olds,
性就講緊8
there's
至9%
89% of male who has this.
咁但係如果話
If you're
65歲以上嘅
65
人
and
有呢個
above,
病，
a
高血壓
quarter of
人
you
咧大概
have
一半有。
this illness. And for those with high blood pressure, half of those will have sleep apnea.
呢個病，如果高血壓要食2-3種藥咧，8
If you have high blood pressure and you need 2 to 3 types of medication to control your high blood pressure, then 80% of those people will have sleep apnea.
有呢個病，血壓、糖尿、膽固醇都有齊咧，都係80%。
If you have high blood pressure, if you're diabetic and you have high cholesterol, then 80% of those will have sleep apnea.
都有呢個病，呢個病會係一個血管風險，會引起血管
This illness will cause vascular disease.
問題，引起胃酸倒流
It
同
will
青光眼
it'll cause heartburns, glaucoma,
有關，同記性差
and
有
poor
關
memory.
哇，好大打擊啊！
I'm shocked.
好大打擊。
嚴重先會係嘅，輕微嘅關係不大。
Those are for severe cases, not so much for mild cases.
咁你而家呢個係淨係睇到有啫，唔知嚴重定輕微。
You can only see that I have it, but you can't tell whether I'm severe or mild,
所以我
right?
哋點樣去斷定
So
輕微
how do we
定嚴
diagnose
重咧？
whether
我哋需
you're
要
mild
做
or
一個
severe
檢查，
case?
叫睡
So
眠
you need
檢
to
查。
do a test called a
我知
sleep
呢件
test.
事
咩好多嘢㗎嘛？
You'll be connected to a lot of wires, and you sleep through the night.
瞓一晚，第二朝去睇下咧，
And the
一個
next
鐘
day,
唔正常嘅呼吸，即係淺呼吸。
the next day, the test will show how often there are abnormal breathing per hour.
停止呼吸發生幾多次？
How many
一個
times it
鐘多過
happens?
5次咧，
If
叫
it
有呢個
happens
病啦。一個鐘多
more
過
than
30
5 times
次叫嚴
an
重。
hour, then you are diagnosed with sleep apnea. But if then you'll be a severe case if you have abnormal breathing more than 30 times an hour.
哦，哇！一個鐘多過30次唔使瞓啦。
How do you sleep if you have more than 30 abnormal breaths in an hour?
我哋見過最嚴重一個鐘120次都有，
The most severe case I've seen is 120 times per hour.
即係1分鐘2
That
次啦，
means an
1分鐘
hour,
停2次，1分鐘。
twice per minute.
哦，咁好危險喎！
Well, that's so
你講嘅係
dangerous
實息啊嘛
because you're talking about
所以你見到
suffocation.
一個鐘120次就
On the contrary, 120 times per hour is actually not too dangerous.
反而唔係太危險，即係嗰個腦會醒。不過
It's
點
because
解
your brain will wake
點解
up.
窒息會自
Well,
己又會
why
唞返
would
氣
you
咧？
breathe
最
again
主要
if you're
就係當個
suffocating?
呼吸道變得窄或者關咗門之後咧，
It's usually because once your airway has narrowed down or has shut,
空氣入得少啦，
there's
血入邊
less
空
air
氣
going
血
in,
慢慢少就血
and
氧
then
慢慢下降。
the
氧
oxygen
氣
in
跌
your
到一個
blood
level，
will
跌到一
drop.
個程度咧，個腦就會醒，腦一醒
And once the oxygen level has dropped to a certain degree, your brain will wake up.
肌肉緊張。
And as soon as you wake up,
唞兩啖氣正常
your
再瞓
muscle
1分
will
鐘2次，
expand.
1個鐘咪120次啦。
And when it happens 120 times per hour,
所以經常會醒。所以
you'll
我哋
always
講
wake up many
睡眠窒
times.
息會唔會窒息下去咗嘅咧？
So will you die from sleep apnea?
都會，但係
Yes，
發生嘅機會就比較少。講緊即
very
係
rarely
18000個先有一個，
Maybe 1 in 18,000 cases.
唔係因為窒息而
You don't
走咗
die
去，因
because
為
you
窒息
suffocate.
氧氣低，
It's because you have a low level of oxygen in your blood,
個心臟病發
And it
一下
causes a
心跳
heart
亂
attack.
一下心臟病發。
you'll have arrhythmia, and then which causes a heart attack.
因為所謂心臟病，我哋話冠心病咧，血管窄。
When you're talking about coronary artery disease, is when your blood vessels narrow down,
咗供應氧氣唔到俾個肌肉，但係如果
and the blood doesn't pass the oxygen into the muscle.
半夜瞓覺大環
And
境
if
入
you're
邊啲氧氣都低
sleeping
過頭，咪心臟病。
In the middle of night, you can have a heart attack when the environment has a low level of oxygen.
所以心臟病發最多嘅時候，
So many
唔係
times,
做運動啊，瞓覺時。
You don't see it.
Many
you don't
times,
think about it until the unexpected
heart attack
happens.
is not caused by
With
exercising.
Apollo tenant and
It's caused by it happens in the
係
sleep.
啊，瞓翻一覺啊。
So yeah, many times it's when you're sleeping.
其實佢個
Okay.
成因係咩咧？
Why does it
有
happen?
關即係體重啊、
Is it about
肥胖啊
weight
瘦
or
唔關事
obesity, or is it
係
about
係咁係。
其實
your
成因
body
係
weight?
好多
Well,
樣嘢
there's
都
so
同關
many
事
reasons why it
肥
happens.
係關事嘅，點解肥
Yes,
關事？
overweight
如果
has
肥
something
啲
to do
咧
with it because if
脂
you're
肪就會
overweight,
積
there's a
咗
lot
喺
of
肌肉
fat
度，肌肉就會鬆啲。
in your muscles,
肌肉
and then
鬆
your
啲
muscle
嘅話
will
變得
become
大嚿
loose.
肌
And when loose
就
muscle
呼吸
becomes
道周圍
big,
都係肌肉，肌肉一大
and
嚿，
your
呼吸道窄咗。
your respiratory
所以嗰
tract,
條路窄，一瞓着覺咧，
your respiratory tract is full of muscles. So when you're sleeping
人一放鬆肌肉
and
再
you
放鬆
relax
多
your
啲，
muscles,
第三或者佢睡眠
your
窒息
airway
醒
will
嗰陣時
close.
唔會㗎，所
and
以
it
肥
won't
肯定
happen
係
if
個
you're
原
awake.
因。
So
咁我哋
being
結構
overweight is definitely something to do with it.
結構下
And
巴
then your
縮得
facial
後
structure, like
都係
recessed
一個
chin,
原
is
因。下
also
巴
another
縮後
reason.
上腹耷會唔會窄啲啦？分
When you have a recessed chin, your airway becomes tighter and narrower.
咁咪再窄啲。
And when you're asleep,
咁好多人會問
it
點解
becomes
我下
even
巴
more
縮後
narrower.
啊？
A lot of people ask why does the chin recess?
我哋話通
There's
常
usually
兩個原因。
two
第一
reasons.
個原因遺傳啦，
First
呢個樣
of all,
唔
it's
係
from
似阿爸定似阿
genetics.
媽啦。
It's either
第
like your dad or
二
your
咧，
mom.
細個有鼻敏感。
And
香
number
港
two,
我
you
哋講鼻
had
敏感嘅細
allergies
路
when
一
you're
半
young.
有嘅。
And half of the children in Hong Kong has allergies.
鼻敏感嘅細路，你見到佢點知佢有鼻
Children
敏感？
with
真係神算。
allergies is very easily detected
唞唞氣嘅。
because they breathe
一
with their
專心
mouth.
就擘大個口。
And when they
鼻
focus, they
塞
breathe
咪
with their
用口
mouth
用啲。
because the
細
nose
路
is
仔有
plugged.
時候成日開住口，
So they breathe with their mouth open.
下巴就發育得唔好，應該向前生。
So when you breathe with your mouth, your chin does not grow forward.
生唔到出嚟，所以我哋成日都講，小
So
朋友
many
鼻敏
times
感
we
要
say
控制，
we have
唔
to
係純
control
粹
your
令佢
children's
舒服
allergy,
啲，
not
我哋
just
希
to
望佢
relieve
習
it,
慣
but we
個鼻
want
口
them
氣，
to get
下巴可以
used
生
to
到出嚟，
breathing
下
with
巴
their
生唔到
nose
出嚟咧，
so their chin
到
can
咗
grow
10零
out.
歲要箍牙啦，因為唔夠溫。
And if they don't do that, their chin will stay recessed. And in their teens, they'll need to get braces because there's not enough space for the teeth to grow.
俾啲牙生啊，唔係牙多係個下巴
Not
唔好
because
生
there's
到
a
出
lot
嚟，
of
地
teeth,
基
it's
唔
just
夠大。
because the
早
foundation
啲
isn't
控制
big
鼻敏
enough.
感，對呢
So
樣
the
嘢
earlier
好
you
處。
control your
到中
allergies,
年
the
就
better
會
it
容易
is.
有減少睡眠窒息症嘅。
And there will be less chance of them getting sleep apnea when they're in the middle ages.
係啊，我就係我細仔
Oh,
講
I
啊，
had
細仔
very
講好
severe
嚴重
allergies
啊，鼻
when I
敏
was
感
young.
真係慘啊！真
我
係
細個唔識
Oh,
你
I
嘅
didn't know you back then. Ha ha ha.
想喊啊！
Oh, I want to cry. I've never wanted to cry on a show before.
跟住睡眠窒息啦
I have everything, and now I have sleep apnea.
窒息醒
I will really wake up from being
嗰
suffocated.
冇錯啦，窒息醒。如果所以
Yes.
我哋成日都問
When you
佢，
feel like
通
you're
常問佢就
suffocating
係
and you wake up,
有冇
we always
俾
ask
自己
them,
嘅鼻
have you
鼾
been
嘈醒過？
awoken up by
如
your
果
own
有咧，
snoring?
冇得走
If
啦，
you
因為
if you
嗰下
said
就好明
yes,
顯唔係鼻鼾。
then it is sleep apnea. There's no running from it because that is not snoring.
鼻鼾係瞓着覺，
Snoring
呼
is
吸
when
道窄
you're-
自己唔知嘅。
Is when your airway narrows when you're asleep and you don't know it.
但係有啲人咧，佢閂埋咗，氧氣太低，個
But-
腦醒，腦一醒肌肉
But if there's a situation where the airway closes when you don't get oxygen, and then your brain doesn't get enough oxygen and it wakes up,
將
The
打
muscle
開腦醒
opens
先就咔一聲，佢以為
and then your brain wakes up and then the muscle opens. You'll think that the person woke themselves up from their snoring.
醒自己唔係，佢
But
醒
it's
咗之後
actually
個呼吸道打
you woke
開
up
嘅。
and then the
所以
airway opened
聽到
up.
嗰下嘢，
So when you hear
基
it,
本上都
it
冇得走
actually
啊。
is.
有啲女性話我
Some
平時
ladies
我
say,
可以做
no,
facial，
I
瞓喺
don't
度
snore, but when I go get my
突然
facial done,
之
I
間
get woken up by
基本
myself.
上冇得走。
That's usually sleep
哇！咁
apnea.
即係個個都有
Wow,
喎。
that means everyone
常
has it.
見
Yes, very commonly.
但係咁點樣個
But
嚴
how do
重
we
程
tell
度？我
whether
哋點樣
if
去
it's
即係
severe or
輕微啊
mild?
定係點？我哋
所以要
幾時要
When do we have to
要
go
揾
see a
你
doctor?
嗱，我諗如果
Well,
通常我哋就係講，如果個
I
人話
think
我瞓夠
for
啦，
a
瞓咗
person
6-7
who has
個
enough
鐘
sleep, 6 to 7
但係瞓極
hours,
都攰嘅，
but they
或
still
者我
feel
隨
tired
時隨地瞓
afterwards,
得着，
and they can sleep anywhere, then that means their
當然
sleep
瞓覺
quality
真係
has
有
an
問
issue.
題，唔係表示有睡眠窒息，
It doesn't mean that you have sleep apnea when you have poor sleep quality.
可以有其他病
You
影
can,
響
there's
到，
other
但
things
係
that
需
affect
要
it
留意。
that you need
咁
to be
另外
aware
就
of.
係，如
For
果啱啱
example,
診
if
斷到有
you've
高
been
血壓、有糖尿病，
diagnosed with high
美
blood
國
pressure,
家庭醫
diabetes,
協會好多年前都講，
and
啱啱
family
診斷到嗰啲
doctors
人，第一個要做嘅檢查啫。
many years ago has said once you've been diagnosed with such illness, the first thing you do
睡眠檢查，因為
is a sleep
傳統
test.
上我哋成日都講
Because
高血壓大部
traditionally,
分冇原因，其實唔
there's
係
no reason for high blood pressure,
冇原因，係醫生唔知道嘅原因
but there is a
嘅。
reason.
我哋而
The
家
doctor just doesn't know. But now
個
we
人係
know
高血壓嘅，所以需要如果及早知道控制咗咧，
sleep apnea can cause high blood pressure, and
如果血管未變得硬
If
化，
we-
有機會
if we knew
可以食
earlier,
少啲。
then there could be intervention done. Hence, the patient may need to take less medication.
藥都唔定。
咁頭先係咪你都提過，即係睡眠窒息主要係男性居多啲㗎？
You did mention that more males get sleep apnea.
對，
Yes.
喺收經之前咧，
Before menopause,
50至60歲
50 to 60-year-olds,
男女一樣，
male and female has the same chance. There's 13.5% of those in Hong Kong who has
如果
this.
係未收經嘅
But
女性
before
荷爾蒙
menopause,
會穩定
the
上呼吸
female
會有啲作
hormone
用。
has the female hormone has airway stabilization in their hormones.
所以女性比男
So-
性少一半嘅睡眠窒息。
Female has less chances of getting sleep apnea than male by half.
但係收咗經之後就一
But
樣。
once menopause is passed, it's the same. But how do we treat it?
咁所以
There are
通常
many
我哋
ways to
講
treat
點解
it.
呢個病咧，第一樣嘢就係點解
Usually, we talk about why you have this illness.
佢會有呢個病，有冇個原因？
Is there a
如
reason?
果嗰個人有睡眠窒息，純粹因為肥減肥
The patient can go lose weight if weight is an issue.
咯，我哋知道
And
減
then
肥一成睡眠
if
窒息
you
症嘅
lose
嚴重
weight
程
by
度下
10%,
降1/4至2成
the degree of sleep apnea will decrease by 20%.
半嘅嚇。咁所以如果你話大部分人
So
有呢
if
個病
most of us
咧，
have
就
this
係肥咗
illness
少少，加埋個下巴
is due to overweight, being overweight, and the facial structure of the chin.
有結構問題。咁你下巴結構，你話點樣
Then
改
how
善
do
啊？
we
係咪
improve
做個
the
手術？有個
structure
手
of
術
our
做嘅
chin?
叫下
Well,
巴移切
there's a
術，
surgery.
不過好大。
There's a surgery that could be done. And
件事要打斷嚿骨直兩
It's
嚿
called
骨
chin
成個下巴拉
augmentation.
前。
they have to break the bones here and then pull the chin out. You cannot eat solids for a whole month, but we do have data for the past 3 to 4 years, and the success rate is very high, but it's a very invasive procedure.
通常即係咩人做呢？
Usually,
啲天
who
生
will
嗰
go
邊
do
好
it?
畸形，有啲
People with facial deformities, children with deformities in their chin. Number one, they'll look better, and then number two, they'll have less
係要用一部叫
complications.
正壓機。
And
因為我哋
the
講
other
你
way
有
to
呢個
treat
病
it
瞓
is
覺
with a
時
CPAP
呼吸道
machine.
閂埋啦，
So when you
所以
sleep
用
and
部
your
機
airway
吹少少
closes,
風落去，嗰啲風可以用個鼻
the
塞
wind will
啊、
blow,
鼻罩吹落去，用啲風嘅壓力撐。
the wind will push through the nostril and deliver a continuous positive airway pressure
住佢。
哦，
以前
keep your airway
30 年
open.
前咧，我哋仲要試
30
幾
years
大
ago-
風可以撐得住呢個人，依家唔使啦。
30 years ago, we still had to test how strong the wind has to be to keep the airway open, but now we don't have to.
有啲聰明機嘅，要
Now it's a
要根據
smart
嗰個需
machine.
求，因為自己調節嘅機器。
They will adjust according to the needs of the patient.
所以呢個係主流，但係需要用機嘅人咧，80%都用得好好。
So this is the mainstream treatment, and those 80% of those who use this treatment has very good results.